Welcome to today's show of Let's Talk About Animals. This is the second part of an interview with Dr. Joseph Raemaker, a renowned veterinarian who specializes in nutritional remedies for animals. If you missed part one, please check us out on our website.
It only takes 18 months, break this chain, it only takes 18 months to get back to normal. What I'm doing, in other words, where antibiotic is effective again, once we quit feeding them in and creating this resistance because of the rapid fire of microbial replication. Now, the work I'm doing is truly my passion, is to clean up this food chain. I'm not here to demonize the pharmaceuticals. Without them, we would probably not be here. Modern medicine, Western medicine, Eastern medicine has been a blessing. What I am here to say is that we can stretch the life of this beautiful phase of science and medicine by using immune modulators adjunctively or integratively in medicine, pulsing them, getting more bang for our buck. I'm just saying let's use them with discretion. Let's raise the immune system. Let's think for a minute. I'm going to ask you, why do you give an antibiotic to an animal other than being sick?
I'm not sure. Personally, I believe that we should save the use of antibiotics for real emergencies, and I try to avoid them at all cost. I've heard that it has something to do with protein, but maybe it just boils down to profitability.
I'm talking more, not the stress antibiotic. I'm talking about, say your dog goes in with a kennel cough, or say he goes in with a bacterial infection. The vet's going to prescribe antibiotics. Did you ever stop to think, say, why is he giving him antibiotics? He's obviously sick. But the depth of it, to level the playing field with the immune system. See what's going on right here? It's a number game.
Okay.
You have bacteria here, and you have the immune system down here on your sick dog.
Okay.
Penicillin comes in, raises the playing field, but you don't give it forever, do you? You only give it till the immune system catches up and says, I got it under control. Penicillin, go away.
Okay.
I got it. I can take care of it. My goal, get this immune system up here and give it a 40-50% advantage. So when you use penicillin, you use it half-life. You only have to give half dose maybe, or half the length of time. Think what we're doing to the food chain and the environment by only giving these antibiotics a limited amount of time, balancing it with the immune system.
Okay.
Does that make sense?
Yes, it does. Now, you had said something, a term which I'm not familiar with, and maybe our viewers are not familiar with either. Immune modulator. Would you tell us what that is exactly?
Modulation means we have the ability to downregulate with these products. Autoimmune disorder. I'm going to use myself as an example. I have rosacea, which is a reddening of the face from a glass of wine, cup of coffee, caffeine. It's my Dutch heritage, I'm afraid. But anyway, I was on metronidazole cream, I think, and nanocycline to manage it. This was 10 years ago before I was introduced to these polypeptides that I work with. Since being on those for 9 years, I've never had an outbreak of rosacea. This is an example of an overactive immune system. So, transfer factors are educational peptides. I work with those. They downregulate the immune system. They bring it down and say, hey, you're going too fast. That's what rosacea is. Asthma, hay fever, lupus, pemphigus in horses. These are autoimmune. Pemphigus in dogs. These are autoimmune disorders. That's a runaway immune system. We have the ability to bring it back to normal. That's called modulation.
Okay.
And autoimmune is the buzzword in medicine today. I mean, very different. You throw prednisone, cortisone at autoimmune dysfunction. We have the ability to help manage and modulate this system.
And this is through natural.
Yeah, all natural ingredients.
All natural ingredients, not synthetic.
Yeah. Pulling the peptides, we call them polypeptides, out of dairy colostrum, avian egg yolk. Now remember, these are educational peptides. They talk to the immune system, the T cell we're going to call it, the immune cell. These are little Pac-Men that go around our body, you know, in the veins, and they gobble up bacteria.
Okay.
Okay, visualize, you ever see The Fantastic Voyage?
Yes.
Remember they went in and they took the submarine, shrunk it down, put it in the vein, and they went in to bust up this blood clot. Remember the submarine was being attacked by those are white blood cells. Okay, they're vicious when they're trained right. They're going to kill anything. My job is to train them with the things we have. That's what I'm doing. We're training this immune cell to go after what is not you. Cancer cells, virus, bacteria, yeast, fungi, going after. And we have the ability to train that cell. And by doing this, we've unleashed the most powerful antibiotic in your body, that more than any antibiotic that you could ever take orally or injectable. The immune system is unbelievably powerful.
It's so incredible to me, the success rate that you have in being able to remedy cancer in our pets. And I know that this also works in humans too, but it's amazing how you can prolong the life of an animal that has cancer, and in some case actually take that into reversion. Is that correct?
Yes, it is. I want to put that in perspective. Remember, we are a nutraceutical. We are not an FDA product, so we can't make a claim here that we're saying, hey, I cure cancer. We don't. We are an integrative medicine product. Adjunctively, we complement Western medicine, I like to say. Don't toss out chemotherapy or Western medicine. I'm trying to make Western medicine better. And by using these products, again, training the immune system to be very active, you're going to get more mileage out of Western medicine. And yes, some of the vet eye tabs, I have wonderful success. 35% probably total remission on a lot of tough cancers. And I would say 70–80% on some of the benign tumors. You know, but I don't want to interpret this as a claim. I want to say this is many times with chemotherapy, as a standalone, as a nutritional supplement, training the immune system. That's what we're trying to do. Now, I'm going to give you I'm going to go back just a little bit because I think it's only fair that the listeners understand when I talk about polypeptides, I said, it's just some biochemists throwing big 25-cent words at us. What we're really talking about is dairy colostrum. Mammals, the first milk you take is colostrum. Okay, it's kind of a grayish substance. And it doesn't even look like milk, but it's loaded with these powerful little polypeptides called transfer factors. And transfer factors are, really it's a cytokine soup of 10,000 Daltons and under. That's really tiny. Of interferons, interleukins, lymphokines, growth factors, salts, and transfer factors. They're in there, but the transfer factor is a really interesting one. It immediately, about 12 hours before birth, the teat canal explodes with these transfer factors. And their job is to train this naive newborn. It's a blank slate. The newborn has no education. It really doesn't know what to do, especially in dairy cattle and horses. They need passive immunity, we call it. Train that immune system to go after what's not me. Without that, the animal's going to die. If you don't get colostrum into a newborn foal, or a young calf's going to die. So you have to train that education. We have learned to harvest that product. Now this isn't new. This goes way back to 1949. A gentleman named Lawrence isolated this out of white blood cells. It laid on the table because it cost $20,000 to isolate out of white blood cells and take a disease I have, pull the white blood cell information, send it to you. So it didn't go anywhere. About in the middle 80s somewhere, there were a couple bright guys in Florida, I think it was, found that it was abundant.
There were two bright guys in Florida?
Hey, careful now.
I'm sorry. I'm from Florida, I can say that.
Just don't pick on Nebraska, okay? But in the period of time, these fellows found out that it was abundant in dairy colostrum, and then we discovered it was abundant in avian egg yolk, because the egg yolk has these educational peptides for the developing fetus, the developing chicken. And we've learned to isolate those. Now, let's figure we got an educator here. Transfer factors, remember, are these little bitty peptides that go into your body and say, hey, T cell, immune cell, don't go, here's what a virus looks like. Technically, it's an 8 amino acid long guy, and it's got 44 amino acids on the tail that identifies an E. coli or herpes 1, 2, all of this, to make it simple. This little 8 amino acid has configuration for every virus and bacteria. We think there's over 3,000 of them identified in the dairy cow, not to mention what's in the avian egg yolk. That particular education, I learned, got me a long ways. We got patents with it on modulation in difficult diseases. It carries a U.S. patent for Cushing's, EPM, equine protozoal myelitis, benign tumors, onchocerciasis, and hypothyroidism. Well, several years after that, I started focusing on glucans, we call them. And glucans, I'm going to cut right to the chase, so I'll get into science, is the gasoline to make the educator go fast. Facilitator, I'm going to call it.
Okay.
The gasoline to make this all happen lies in the glucan power of mushrooms, nanofraction yeast cell wall, and in that I've cultivate probably 20 different mushrooms, hybridized them. I have custom-made mushrooms for me, custom-made nanofraction yeast cell wall. This is the gasoline to make it go. I don't do a lot of university research. I like field research because I'm a veterinarian. I think a PhD nutritionist or somebody would actually like p-value research. I like to see mass numbers. I've probably done 300,000 to 500,000 head of cattle, looking at results going into the field under all conditions, from sale barn cattle, which are high stress, to cattle with no immunization coming direct off the cow into the feedlot. Using this product, day 1, 2, and 12 in my protocol, and by the way, we have to protect this product with a lipid coating to keep it from being beat up by the rumen of cattle. But we've taken morbidity from about 27% down to the area of 3 and 4% in many of these cattle. Death loss taken way back, and this is all natural products. Training that immune system again to recognize these bugs from all over the United States. We collect our colostrum from 48 states. What's that tell you? The dairy cow from 48 states has the education in that colostrum for every bug on the United States, right?
That's
and that
brilliant.
Goes into our product.
That's brilliant.
Thank you. Thank you. Well, some of it's luck.
Chance favors the prepared mind.
Yes, some of it's luck.
You know, it's fascinating. It really is. And I'm thrilled that you're doing this work. It's very important that we don't overuse our antibiotics, because we can actually have it so that the bacteria takes over and we're actually jeopardizing the human race. So thank you so much. Now, and I know I'm not supposed to ask this question.
Uh-oh, here it comes.
So, yes. So what are the ramifications of this for human medications? It seems like if it works in animals, it should be able to work in humans.
It does. It does. My personal issues, as I say, were rosacea, cold sores. I'd get them 2 weeks. I haven't had a cold sore in 9 years. Dental, periodontal health. I used to have some cups, 3s and 4s. They're back to 2s and normal because I use the toothpaste with transfer factor in it. But the human side is huge. I focus on the vet side. I will say they look at my work. A lot of times they look at my research. They're fascinated by the diurnal rhythm work I've done. And so they do bridge it. And hopefully
but your patents, I think that you were telling me that the patents that you get for animals, because we are, as humans, animals too, also apply for humans.
Yes, yes. Yes, what goes on in the animal is almost 90% of the time directly applicable to human. Very, very much so. And I like to think that I'm helping get some information over this way. I would hope someday there's a new product. You're going to laugh about this one. About 2 years ago, my daughter and I, she's 18, I said, hey, you got to raise a litter of pigs to really appreciate what pigs are all about. So we feraled out 2 really high-end show pigs. And I took these, they were back in Santa Cruz. I bought them back in Nebraska. Show pigs are special. They're the ones they pay $600 for and show them. The kids want to, go win the fair with them. So I said, let's feral out 2 sows. And I took them, and one sow had, she had 11, and the other one had 9. But you always get runts. We call them runts, which really a runt is just a grocery-deprived animal. And a runt, there's, in other words, not enough faucets. If you got 10 faucets, you got 12 pigs, you got 2 runts, because he's competing. So I took the transfer factors we have in the glucans, I highly concentrated them, and mixed them with goat's milk. And when I saw a run immediately, I popped them with a little mouthful of it. These pigs caught up, didn't lose a one, went on, long story short, never got lower than 4th place in the fairs, and one runt went